A major proposal in the governor's budget would change health insurance for state employees.
New at 6 tonight, political reporter Jessica Arp explains how this change could matter to you.
So the model as it stands now has the state pay HMOs for your health care coverage in advance. That model would change to having the state have you go to the doctor, have the doctor send them the bill administered by some health care companies. So would the average state employee notice a difference?
For an individual, this won't look any different for you. So you'll still have an insurance card. You'll still go to the doctor and they'll place a bill, and the bill will first go through insurance. So for an individual going to your doctor, it really probably won't have any change.
Except one caveat to this, you may not be able to keep your current doctor.
There will be certain places in the state, though, where there will be a big disruption. In particular, in Dane County.
The self-insurance plan, as it was approved by the Group Insurance Board, would take the state from 17 possible health insurance administrators down to 7, differing by region. So that means if you use a smaller health insurance provider like Group Health Cooperative or Mercy Health, you may no longer be able to see your doctor.
Elsewhere in the state, there will be a few small systems, especially very small integrated community health systems that likely won't fully participate. But we don't know all the details yet of exactly which doctors will remain in the network.
So what if you're not a state employee? You may care about the cost. The state is assuming more risk by paying directly instead of having an HMO assume the risk. But you really may care because of the ripple effect.
By removing all of these state employees from the network of some of these smaller players like Group Health Cooperative, it could hurt their competitive position over time. And that may lead them to potentially exit the market or be bought up by other players. That would be a downstream effect that could happen over time.
Finally, there's just the dollars and cents of this. Competing consultant reports to the Group Insurance Board gave them differing numbers. It could save $40 million, it could cost $100 million, or the governor says it could save anywhere from $60 to $120 million. So which number is right?
I think the key thing to take away from all of that is that there is huge uncertainty as to how much money this will save and even whether this will save any money.
Still a lot of questions remaining. That was Jessica Arp reporting that self-insurance plan would still have to be approved by the state legislature.
The lawmakers have already been expressing concerns about how the change might affect the insurance market.